In this video, you're going to learn why you get sciatica and how to fix it. Good morning, I'm Dr. Craig Dingman. This is Elevate TV. If you've suffered from low back pain, and it's that kind of back pain that is really deep and achy and it shoots down and refers into the groin or the buttock, into the hip or down into the leg, it can even go all the way down into the toes, that's what's known as sciatica. It's not really a diagnosis, it's more of a description of symptoms. There's a whole bunch of different causes. It can be extremely difficult to diagnose, even with advanced imaging. But what I've seen is that every sciatica sufferer has these three things in common. And I'm going to teach you about those three things today. Until you address these three things and correct them, you're going to be sort of plagued with this recurrent episodes of low back pain with sciatica that you get 2 or 3 times a year. They get worse and worse, and maybe when it started you were just a back pain sufferer, and then after a few years and a few bouts it referred into your hip, and then after a while it started referring right down into your leg, and might last 3 or 4 days to a week or two, and you get several bouts a year. That's a description of sciatica. There's a number of different causes, and I've got them listed up here in order of least common to most common. So there are some sinister causes of sciatica. Fortunately, they're extremely rare. Things like tumors, cancer, those types of things. The research shows us less than 0.003% are from sinister causes. So chances are you can just ignore that one and forget about it. Although there are some real medical emergencies, which is why you probably need a professional to be able to sort that out for you. The next in the order here is a disc problem. So discs can herniate. Let me show you on this little model here. Discs are the shock absorbers between the bones of the spine. And if the disc shoots out, you can see there's the nerve root of the sciatic nerve. You can put pressure on there, and that can create pain, numbness, tingling, electricity, those symptoms anywhere down the leg. So disc herniations, disc injuries are real causes of sciatica. Arthritis as well, I'll show you on the model here too. So if you have some arthritic changes where the spine is not moving right mechanically in your lower spine, that will cause your body over time, if it's not fixed, to lay down extra calcium. So these discs can collapse and your body will lay down spurs of calcium in and around this area, either in the middle where the spinal cord is or where these nerves exit the spine. Can be acutely painful, again, causing pressure, pain, neurological symptoms anywhere that nerve goes. One of the other causes is this piriformis muscle. So I'm going to just take this off. I'm going to show you on the diagram here. You can see where the sciatic nerve goes. So unfortunately, these charts are very anatomically correct. I want to make sure that we have a G-rated teaching here. So we have our poster of the nervous system, and this is the lower spine. And off the lower spine, every one of these little branches here, there's about 5 of them in the lower spine that branch together, braid together, and form this large sciatic nerve. And they go right in the pelvis, over front of the sciatic, the sacroiliac joint, and then go right down. You see this yellow line? This is the sciatic nerve going all the way down. It branches even to the tips of your toes. So there's a muscle that lies over top of that nerve called the piriformis muscle. Now, if you've had sciatica, somebody probably has talked to you about piriformis syndrome or your piriformis muscle. And if you've gone for deep tissue massage, somebody's probably stuck their thumb or their elbow into this muscle right in the middle of your buttock. And actually, it's cut away here, but you can see this muscle in the buttock, and the sciatic nerve would go right under it. And if it's inflamed or irritated or too tight, it can cause symptoms of sciatica. And the other issue, probably one of the most common causes of sciatic pain, would be mechanical issues with the sacroiliac joint or the joints of the lower spine. So if you look here, this is your spine, this is the lumbar spine, and this is the pelvis. Now where the lower spine meets the hip, it's called the sacroiliac joint. And you can easily feel those on yourself. If you reach your hands in behind your back on either side, you'll feel those bony dimples in the upper parts of your buttocks. Those are your sacroiliac joints. And the sciatic nerve, actually, all these branches come together here. They braid together, and the sciatic nerve goes right down through there, overlaying that that sacroiliac joint. A lot of S's in this teaching today. Some of them are getting blurred together. So if you have a mechanical problem with the sacroiliac joint of the lumbar spine, it can create symptoms of sciatica. But here's the one thing that three things actually that I've seen regardless of the cause. See, most of the treatments that are out there for sciatica right now are aimed at addressing the symptom. Like the symptom is what we call collateral damage. So there's an underlying problem that's creating this collateral damage in the form of a symptom. You might have acupuncture needles put in that can relieve the pain. You might get a chiropractic adjustment that will relieve the pain. You might have some sort of Dr. Ho type TENS machine put on there. You might put some ice on, and those things will relieve the pain and take away the symptom or help work on the collateral damage. But until you address three underlying things, you will be prone to these recurrent bouts of sciatica month after month, or certainly several times per year, and they'll worsen over time as the mechanical issues are worsened. So the first thing I see that is prevalent in every single person who suffers from sciatica is a mechanical or structural issue with the lower spine and the sacroiliac joint. So either there's a structural issue where there's like physical misalignment of the lower spine, or the joints of the lower lumbar spine are just not moving appropriately. So it's a mechanical issue that does not allow proper movement down there, and that will contribute to the development of sciatica. The second thing would be poor mobility. So you may have seen my other video where I showed you how to assess if your hip and low back mobility is proper. If you can't do a squat and keep your feet and your heels firmly on the ground the whole time and squat right down so that your bum is virtually touching the ground, you're sitting right on your haunches, and if you can't stay there for a while, then you have mobility problems with the low back and the hips and the pelvis that are going to be contributing potentially to your sciatica. And until you remedy that problem, again, you will get recurrent bouts of sciatica. And the third thing that's in common with most people, even those of you who might think that your nutrition is good, is people usually have a high inflammatory load caused by something in their nutrition that they're not doing right, that's making their body set up for inflammation. So just to recap, regardless of the cause of your sciatica, until you address mechanical problems in your spine, mobility issues with your back, hips, and pelvis, and potential nutritional problems, you are going to be prone to recurrent bouts of this sciatica, regardless of whatever strategy you're using to manage your acute episodes. So if this makes sense to you and you think this can help someone else who you know is suffering from sciatica, please share this on. Or if you'd like to talk further about this at Elevate Chiropractic, we'd love to be able to see if we can help you if you have these problems. It's Dr. Craig Dingman, Elevate Chiropractic. Have a great day.